So you're looking at Medigap plans and you realize you've got nearly a dozen different options, each with a different letter of the alphabet. If you're turning 65 or just getting started with Medicare, it can feel like you've been thrown into a sea of letters. You've got Plan A, Plan B, Plan F, Plan G, Plan N, and it's just a storm of confusion. You're trying to make a huge financial decision that's going to impact your healthcare for years. And that fear of making a big, expensive mistake is very real. But what if I told you that for almost every single person looking for a new plan in 2026, only 3 of those letters really matter? What if you could just ignore all the noise and all the clutter and zoom in on the 3 plans that are the smartest choices for your health and your bank account? Well, that's exactly what we're going to do today. We're cutting through all the confusion and we're going to show you exactly what those 3 plans are, how they stack up against each other, and most importantly, how you can pick the absolute best one for you. My name is Tim Smith and I'm an independent broker and I help people all over the country with this exact decision every single day. My goal is simple: to give you the clarity to make this choice with total confidence. But before we get into the plans, we have to start at the very beginning. Why do Medigap plans even exist? It's all in the name. They fill the gaps in original Medicare. And believe me, those gaps can be huge. A lot of people are shocked to find out that original Medicare, Part A for your hospital and Part B for your doctors, was never meant to cover 100% of your costs. It actually leaves you wide open to potentially unlimited medical bills. Because there's no ceiling, there's no safety net, you have 20% share of those costs. And that's the problem that Medigap or Medicare Supplement was created to solve. Understanding these gaps isn't just a technical thing, it's the why behind your decision. So let's quickly break down the financial risks of just having original Medicare, because once you see these numbers, the value of a good Medigap plan becomes crystal clear. Let's start with Medicare Part A, which is your hospital insurance. The good news is, for most people, Part A is premium free, meaning you don't have to pay anything to have Part B, because you or your spouse paid Medicare taxes while you worked. The bad news, if you're admitted into the hospital, your share of the cost starts right away and it adds up very quickly. The first thing you're going to get hit with is a Part A deductible. This isn't just a once a year deductible. You pay this each benefit period. And a benefit period starts when you're admitted to a hospital and only ends after you've been out for 60 days straight. So this means if you have bad luck and end up in the hospital twice in 1 year, more than 60 days apart, you have to pay that deductible twice. For 2025, that Part A deductible is $1,676, and the 2026 number will be a bit higher. So right off the bat, one hospital stay costs you nearly $1,700. But it doesn't stop there. Let's say you have a longer hospital stay. For the first 60 days, Medicare has you covered after your deductible. But from days 61 to 90, you're responsible for a daily copay. In 2025, that's $419 a day. So a 90-day stay would mean you pay the $1,676 deductible plus 30 days of copayments at $419 each, which is $12,570. So your total bill for that one event is over $14,000. After day 90, you tap into your 60 lifetime reserve days. The daily copay for these jumps to a shocking $838 a day in 2025. When those are gone, you pay 100% of everything. So the financial risk is huge only having Part A. A serious illness could lead to absolutely devastating medical bills, all while you're supposed to be recovering. Now let's talk about Medicare Part B. This is for your medical services, so doctor visits, outpatient surgery, lab services, you name it. This is where most of your healthcare actually happens. With Part B, you have an annual deductible first. That's what you pay for your medical care before Medicare starts chipping in. And in 2025, the Part B deductible is $257. This is also expected to go up for 2026, with some guesses putting it around $288. Now, after you've paid that small deductible, that's when the real risk kicks in. From that point on, you are responsible for 20% of the cost for every single Part B service. This is your coinsurance. And here's the most important part. There is absolutely no cap on that 20%. It doesn't matter if your medical bills for the year are $1,000, $100,000, or even $1 million. you owe 20% of it. Now let's put that into perspective. Imagine you're diagnosed with cancer and you need chemotherapy. Those treatments can easily cost tens or hundreds of thousands of dollars a year. Let's say your treatment costs $100,000, for example. Your 20% share is $20,000. What about a major outpatient surgery that costs $60,000? Your share is $12,000. And that's why this 20% coinsurance is the single biggest financial trap for seniors on Original Medicare. It's an uncapped, unpredictable bill waiting to happen. You could be healthy for years and then one diagnosis or one accident can flip your financial world upside down. And this is the exact problem that we're here to solve. So the question isn't if you need to fill in these gaps, it's which plan is the smartest, most cost-effective way to do it. So how do we fix this? That's where Medicare Supplement Insurance, or Medigap, comes in. These plans are from private insurance companies and they're built to work with Original Medicare. They don't replace your Medicare, they work alongside it. You still keep your red, white, and blue Medicare card and you add a Medigap plan to pick up the costs that Medicare leaves behind. Now, the most important thing to understand about Medigap plans is that they're standardized, meaning that the government dictates what each of these letter plans has to cover. This means a Plan G from one company is, by law, identical in its core benefits to a Plan G from another company. Same thing with the Plan N. The only things that differ are the monthly premium that company charges and their customer service. This is fantastic news for you because it makes the decision that much simpler. You don't have to stress about one company's Plan G having some hidden loophole that another one doesn't. So your job is to first pick the lettered plan that fits you the best, which we're going to do today, and then find the most affordable, reputable company that offers it where you live. And as an independent broker, this is what I do every single day. I don't work for a single insurance company. My job is to work for the client. I can check rates from dozens of top-rated companies to find you the best price for the plan that you choose. This service costs you nothing. The insurance company pays me if you enroll, but your price is the exact same no matter whether you use me or you go directly to them. The difference is, with a broker, you get unbiased advice and someone to shop the entire market for you every single year so you don't overpay. Now, another huge plus with the Medigap is the freedom that comes along with it. With the Medigap plan, you can go to any doctor, any specialist, or hospital anywhere in the United States as long as they take Medicare. So there's no restrictive networks, there's no referrals needed to see a specialist. If a doctor accepts Medicare, they have to accept your Medigap plan, no matter what company it's from. This gives you incredible peace of mind, especially if you travel or you want to know that you can get the top cancer centers anywhere in the country. So before we get into the specific Medigap plans, you need to know that Medigap plans take your unpredictable, potential massive medical bills and turn them into one predictable monthly payment. You're swapping an unknown financial risk for a known budgeted expense. Now, you might be looking at the official chart and seeing all these different options, A, B, C, D, F, G, and on and on. So why are we talking about just 3? The reason is that because of a big law change and how the market has evolved, a few plans have risen to the top as the best value for most people in 2025 and going into 2026. So first, let's talk about Plan F. For years, Plan F was the king. It covered absolutely everything, including the Part B deductible. But a federal law known as the MACRA changed the game. The law said that as of January 1st, 2020, Medigap plans can no longer be sold to new enrollees if they cover the Part B deductible. The idea was that if people had to pay that small deductible themselves, it might cut down on unnecessary doctor visits. So Plan F and the similar Plan C were phased out for anyone new to Medicare in 2020 or later. So if you're eligible for Medicare before that date, you might still be able to buy one, but it's often not a great idea because no new, younger, and healthier people can join the Plan F pool, so the average age of the members keeps going up. And an older group means more health claims, which makes premiums go up faster than other plans. And that's why we're consistently seeing Plan F premiums getting more and more expensive compared to Plan G and Plan N. So what about the other letters like A, B, D, Honestly, they don't make much sense, and let's go over them. So plan A and B have pretty weak coverage, and they leave you on the hook for major costs. Plans K and L are complicated cost-sharing plans where you pay a percentage of your costs until you hit a high limit, which isn't what most people are looking for. Plans M and D are niche plans that are rarely the best deal. So after clearing all of that clutter away, we're left with the 3 plans that really hit the sweet spot of coverage and the value for 2026. So we've got Plan G, Plan N, and the high deductible version of Plan G. These are the modern core of Medigap. So let's take a more in-depth look at each one. For anyone new to Medicare, Plan G is the most comprehensive plan that you can get. It has truly become the new go-to plan for anyone getting onto Medicare with the highest level of protection. And this is exactly how it works. So the beauty of Plan G is its simplicity. It covers every single gap of Medicare except for one thing, the annual Part B deductible, which in 2025, that's $257. Once you pay that small amount yourself for your doctor visit, Plan G pays 100% of all your remaining Medicare approved cost for the entire year. And that's it. So when I say 100%, I mean it. After one deductible, your Plan G covers everything. So that big Part A hospital deductible, the $1,676 this year, that's covered. Your daily hospital copays are covered. Your 20% coinsurance for everything, surgeries, chemo, doctor visits, that's covered. You remember that $100,000 cancer treatment example earlier in this video? With just Medicare, you would have owed $20,000. With Plan G, you'd pay your Part B deductible, and that is it. You would have 100% coverage. And you would get no more bills the rest of the year. So you'd have peace of mind knowing that your healthcare costs are just the monthly premium that you pay for the Plan G. Now, a huge overlooked benefit of Plan G is that it covers something called the Part B excess charges. This is an extra 15% that a doctor or a surgeon can legally charge you on top of the Medicare approved amount if they don't accept Medicare assignment. While most doctors over 95% do accept assignment, some specialists don't. Plan G comes in and they'll pay those charges completely, so you never have to worry about it. It removes one more potential surprise bill. Now, Plan G is perfect for someone whose main goal is predictability. It's for the person who says, I want to pay my premium and not worry about getting another bill from a doctor or a hospital. You want to budget your healthcare costs with almost perfect certainty. The premium is higher than Plan N, but for many, the rock solid coverage is worth every penny. Next up is Medicare Supplement Plan N. It's a plan that's become super popular because it's a great balance between strong coverage and a lower monthly premium. It's for the budget conscious person who is okay with a little cost sharing to save money every month. So this is how it works. Plan N is very similar to Plan G, but with a few key differences that make it cheaper. You still have to pay your annual Part B deductible, the $257 this year, but after that, Plan N covers the other 20% coinsurance, but it has a couple of small copays. So with Plan N, you may have 2 different copays. You'll have a copay up to $20 for some doctor visits, and you'll have a copay of up to $50 if you go to the emergency room. But this is waived if they admit you into the hospital. Now, the phrase up to is important. The copay is never more than $20. And if your 20% share of the bill is only $16, you only pay $16. So things like telehealth visits usually don't have a copay. So think about it like this. If you have a Plan G, you go to the doctor and pay nothing after your deductible. With Plan N, you might pay a small $20 copay. If you go to the doctor 10 times a year, that's a max of $200 in copays. But the premium savings on the Plan N versus Plan G could be $400 or $600 or even more every single year. So for someone who's pretty healthy, the math on Plan N looks pretty good. But there's one other difference, and it's the biggest difference between G and N, and it's important. So Plan N does not cover the Part B 15% excess charges. This means if you see a doctor who charges an extra 15%, you have to pay it since you have a Plan N. Now, is this a deal breaker? For a lot of people, no. Like we said, most doctors will never charge it. And you can easily check if your doctors do or do not charge it. And you can always ask a new one. Plus, if you live in one of the states that outlaws excess charges, like Pennsylvania, Ohio, or New York, this is a non-issue, making Plan N even better to deal with there. But if you want total freedom to see anyone without thinking twice, Plan G is the safer bet. Now, Plan N is perfect for the savvy, relatively healthy person who wants to lower their monthly bills. You're happy to trade a small, predictable copay for hundreds of dollars in premium savings. If you don't mind doing a tiny bit of homework to make sure your doctors accept Medicare assignment, and if you're focused on value, Plan N is one of the best deals out there. Now, the last plan we're going to go over is the high deductible Plan G. This one has a totally different philosophy. It's designed to give you a powerful safety net against a medical catastrophe, while keeping your monthly premiums as low as they can possibly go. Now, you get the same great coverage as a regular Plan G, but it only starts after you've paid a high annual deductible yourself. So for 2025, that deductible is $2,870. So here's how it works. You pay all your Medicare costs, your deductibles, and your 20% coinsurance until you've spent a total of $2,870 out of your own pocket. Once you hit that deductible, the plan completely transforms. For the rest of the year, it acts just like a regular Plan G, paying 100% of all your costs. So after you meet that deductible, you pay nothing more. The monthly premium for a high deductible Plan G is incredibly lower, oftentimes just $30 to $60 a month. So you're basically self-insuring for the first $2,870 in costs in exchange for huge savings on your monthly bill. Now, this does come with a warning because choosing this plan is a clear bet on your own health. In a good year, you'll save a ton of money. If a normal Plan G costs $2,000 a year and the high deductible G costs $600, you're $1,400 ahead. But the risk is obviously if you have a bad health year, you need to be financially ready to pay the full $2,870 deductible. But here's the golden rule. You should have the full deductible amount sitting in savings ready to go if you want to go with a Plan G high deductible. If having to pay that out of your pocket would cause you a financial pain, this plan is not for you. But this plan is a great fit for two types of people. First, the healthy and financially savvy person who wants to keep fixed costs low, but still have protection against a worst case scenario. They see it as a catastrophic plan. The second person it can be great for is people with an HSA or a health savings account who can use those tax-free funds to cover the deductible because you're taking on a known manageable risk for the lowest possible premium. Okay, so I know that was a lot of information on the 3 best plans for 2026. We've got Plan G for total peace of mind, Plan N for smart savings, and high deductible G for a low cost safety net. You're probably already getting a feel for which one lines up with your life, your budget, and how you feel about risk. But the next question is obvious. What would these plans actually cost me? Because while the benefits are the same, the prices are different from every single insurance company and can be all over the map. This is where I can come in and help. My team and I can run numbers for you for absolutely free with no strings attached. We'll give you a simple side-by-side comparison of the actual monthly premiums for Plan G, Plan N, and a high deductible G from all the top companies in your specific area. And there's no cost for this and zero pressure to sign up. Our job is to just give you the info that you need so you can make an educated decision. So if you want to get your personalized quote, you can click the link below or call the number on the screen at the end of the video and we'd be more than happy to help you. In this video, we've broken down the different plans that are best going into 2026, but this decision really comes down to you, your health, your budget, and your personality. So let's do a quick final check to help you lock in your choice. If you choose Plan G, your top priority is simplicity and knowing exactly what you'll pay. You want to pay your premium and be done with medical bills, besides that one small deductible. If you choose Plan N, you're in good health and are happy to pay a small, predictable copay to save a good chunk of money on premiums every year. You're considered a smart shopper who doesn't mind checking that if your doctors accept Medicare assignment. And if you choose high deductible Plan G, you're in great health, have a solid savings account, and want the lowest possible monthly bill. You're comfortable covering the initial costs yourself, knowing you're protected from a truly catastrophic event. There is no single best plan for everybody. The best plan is the one that fits your life and lets you sleep at night, knowing that you've got the right protection for your needs. Now, there's one more thing that's helpful to know, and it's why your premium is what it is. The price you get quoted is based off of a few different things. Number one is location. Where you live is a huge factor. Healthcare costs are different everywhere and rates reflect that. Number 2 is age. Generally, the older you are, the higher your premium will be. Number 3 is gender. In most states, your gender can affect your rate. Number 4 is tobacco use. Smokers always pay more than non-smokers. Number 5 is timing of enrollment. Signing up during your Medigap open enrollment period is key. That's a 6-month window after your Part B starts, and in that window, companies have to accept you. They cannot ask you any health questions whatsoever. But if you wait, they can deny you or charge you more outside of that enrollment period. Number 6 is household discounts. Many companies offer a nice discount, usually 7 to 12%, if you and your spouse or partner sign up together. Knowing this explains why your quotes are what they are, and it really shows why it's important to shop around. All right, let's bring this all home because I know we went over a lot of information. We started with a confusing mess of a dozen different Medigap plans and boiled it down to the 3 that make the most sense for most people going into 2026. We've established that Plan G is the gold standard for comprehensive, predictable coverage. We've seen that Plan N is the savvy saver's choice, offering a great balance of coverage and lower premiums. And we've identified the high deductible G as the ultimate safety net for healthy people who want rock bottom monthly costs. The goal for this video was to cut through all the noise and empower you to make one of the most important financial decisions for your retirement. And I hope you feel more confident after watching this video. Now, I know retiring and navigating Medicare can be very stressful, but I want to let you know we have left 2 links down below in the description of this video to help you. The first one is where you can get our 2025 Medicare Planning Guide at no cost. We're giving it away for completely free, so please utilize that link down below. It summarizes these changes and gives you a checklist to follow. And the second link is where you can book a free one-on-one consultation where I or a member of my team will personally reach out to you, or you can simply call the number on the screen right now. On this call, we will answer any retirement questions that you have, any Medicare questions you have, and we'll go over the specific plans in your county to see how they'll cover your specific medications, your doctors, and your pharmacies. And all of these services are 100% free of charge, and we can even help you enroll if you find a plan that's a better fit. So feel free to take advantage of those links down below, and don't forget to like this video, comment with your questions, and subscribe to our channel. Be sure to click that notification bell because we are providing immediate updates, and we release videos every single day that are gonna help you navigate the Medicare maze. Thank you so much for watching. Now go watch this video right here where we go over all the 2026 price updates and how they're going up. I'll see you over there.